Hi, this is Evan Steele at SRS, and today I'm here to discuss and show you the SRS's ICD-10 Easy application that'll make your transition to ICD-10 from ICD-9 a smooth transition. The first thing we want to talk about today is just a little bit about ICD-10 and how it compares to ICD-9. There's been an explosion of codes of sorts, whereby there's 13,000 ICD-9 codes. There's now 68,000 ICD-10 codes. And we all know the reason why there's this movement or this move from ICD-9 to ICD-10. There's a lot more specificity in the codes, and obviously the government and the payers are looking for better analytics, better data to do better analytics and measure quality, outcomes, benchmarking, etc. Of all the specialties, musculoskeletal has the largest increase in permutations. In other words, it used to be you had a diagnosis called hip fracture. Now there's literally dozens of hip fracture codes, whereas some other specialties like ophthalmology, for example, don't have it as bad. Most of the expansion in codes are the laterality, the left eye or the right eye. But no matter how no matter how many more permutations you have, I still think there's now too many different ICD-10 codes to fit on a one-page super bill or encounter form. Whereas today, I've seen hundreds of different encounter forms, but usually there's 50 or 100 ICD-9 codes crammed into the ICD-9 form. Into the encounter form or crammed onto the super bill. Now there might be 100 or 200 or 300 different ICD-10 codes, so having a piece of paper is a little bit unwieldy, and that's where technology comes into play. So from I look at ICD-9, the impact on the practice, I look at it from a billing and admin side or from the perspective of the clinician. Here I have a sad face for the billing and admins because I think that's where most of the challenges are going to be, right? On October 1st, 2014, when ICD-10 will be implemented, some payers are going to be ICD-10 compliant and some aren't, so there's going to be a lot of confusion. The payers are going to be using new systems, so there's going to be bugs and issues. We all know how, like with Obamacare, how the rollout of a new system can be problematic. So from a billing and admin side, we show the sad face, and then there will definitely be challenges. But I believe from the clinical side, it will be relatively straightforward, especially with our ICD-10 Easy app, which we'll show in a few minutes. The clinician will be able to easily find the right ICD-10 code very quickly. So the way I look at what's going on in the industry now is we have, if you look at the screen, we have all these people just relaxed in a movie theater. Everyone's in a groove, right? ICD-9, we're all familiar with it. And when you go to some conferences and you hear consultants or physicians talk about ICD-10, it's almost like somebody's screaming fire in a movie theater. And most of the concern comes from these weird ICD-10 codes where I've seen a number of presentations and people talk about the ICD-10 code injury due to water skis on fire and or burn due to water skis on fire. As you could see from this picture here, this is the image that comes to mind. There's also bitten by a turtle, injured by a dolphin. These are the images that come to mind. And for musculoskeletal, there's how did grandma fracture her hip on the driveway? Was it was it icy? Was it at night or day? All these different permutations that people are concerned about. And what they're concerned about are what in ICD-9 is known as E-codes, or external cause of injury codes. And these external cause of injury codes have been around for a very, very long time, going back to the mid-1990s, so almost 2 decades. And I'll give you some examples of, under ICD-9, I'll give you some examples of these E-codes. There's E884.6, fall from a commode. And I'm just trying to envision how somebody would injure themselves doing that, but there is a code for that nonetheless. There's E927.1, overexertion from prolonged static position. And I look at that and say to myself, really? How could that be? But there is a code for that. There's also E996.0, injury due to war operations by nuclear weapon, direct blast effect. I guess, we haven't really had to worry about this code since 1945, so it's been almost 70 years, but there is an ICD-9 code to cover it, just in case. And I'll give you one more example, E927.4, cumulative trauma from repetitive impact. I think that code is used, when you look at your average medical healthcare professional who's banging their head repetitively against the wall, trying to deal with all these meaningful use, PQRS, and ICD-10 requirements. So there are and have been for a very long time these external cause of injury codes, and in fact, AHIMA, the American Health Information Management Association, on their website put out a ruling which they actually pulled from the ICD-10 codebook, which is a clarification of the use of these external codes, external cause of injury codes. And they say, just as with ICD-9, there is no national requirement for mandatory ICD-10 external cause code reporting. Good news, right? We don't have to worry about the water skis, the turtles, the dolphins, or the driveway. The caveat is that if you were required to use the E-codes with ICD-9, you're still required for that set of patients to use it for ICD-10. But I think most of us are comfortable that now with ICD-10, we don't have to worry about those external cause of injury codes. So what about the other codes, all the other codes? I look at it, if you look at this image, to me it's like finding a needle in the haystack. There's 68,000 codes. How do I find the right one, especially in some specialties where one code is now dozens or scores of codes? So that brings us to the SRS demo of our app. And what you see here on the screen is SRS's version 9, which is actually our meaningful use certified stage 2 version. We call it the 2014 edition, at least that's what the industry needs to call it. So we're certified for the 2014 edition, and just note, by the way, exactly 472 vendors that were certified as complete EHRs under stage 1 meaningful use. As of Friday, there was 29 vendors that were certified for stage 2, which means about 95% of vendors who were certified for stage 1 are not yet certified for stage 2 2014 edition. That's a whole other discussion, and why that's happening, but certainly stage 2 development required a lot of effort on the vendor's part. And SRS, we have now almost 60 folks in our development department, and it was a lot of work for us. So you wonder about the implications for some of the smaller vendors out in the marketplace. Basically, there's a lot more that we've put into this version 9, but keep in mind some things that people have been asking for a long time is a consolidated med and non-med allergy grid right here on the top left of the screen in this app. Also, we have in RX history, we also highlight those items or those medications that the patient is allergic to, so it's more in your face and easier to see the allergies. Also, I could go no known active meds. I just click the checkbox, and I don't even have to go into my RX module anymore to do that. So some nice things. We also have an out-of-office messaging feature, so you can see here this doctor is out of office, and his messages are going to be auto-forwarded to either another person in the practice, another staff member, or to a pool. So that's a nice feature, and there's many other extra features that I'm not going to get into now, but that we've added to version 9. But of importance for this this webinar is the diagnosis app. So here's where we could click the little plus right here and pull up the app, and this is where we will search for our ICD-10, or we could use this to search for ICD-9 as well. It'll find both. First, some ground rules about how we search. It's very easy. There are 3 or 4 ways to search for a diagnosis. Let's start with just very basic, systemic disease type diagnosis. Let's look at hypertension. There are several ways we could search for it. We could search for it based on alias. Like right now we have an alias in SRS, but we don't need that anymore. We're leveraging a technology called IMO, Intelligent Medical Objects. And what they do is they have an amazing searchable database of diagnoses, and basically the nomenclature that doctors and clinicians are comfortable with that they use to search different diagnoses are already built in. So for example, I could search for hypertension using HTN. It requires no setup. You just search for it the first time you search and it will come up as hypertension. I could type in HBP for high blood pressure because maybe where I trained, that's where we learned hypertension to be, we use HBP. So that would work as well. We could also type in hypertension, the full word or part of a word. We could also type in little chunks of words. So high blood pressure, I could type in the first three letters of high, blood, and pressure, and it will find it right away. And finally, we could do a crosswalk. A crosswalk between ICD-9 and ICD-10. We could type in the ICD-9 code and look at all the ICD-10s that are associated with that ICD-9. So let me just show you all those ways here. So the first thing we want to do is just search for hypertension. Remember I mentioned before HTN. I click enter and it will find hypertension. It's 401.9 or I-10 is the ICD-10. Let me also search on HBP, like I was mentioning before. Also pulls up the correct ICD-9 and ICD-10 code. Or I could search the first few letters, HIGBLOPRE. Hit enter, and it will find it right here, again, the correct code. Also, I could type in 401.9, which is the ICD-9, and it will show all the ICD-10s. Doesn't matter which one I choose, they have all the ICD-10s, all the same ICD-10s. So easy to search for. I might want to show another one, let's say GERD. I pull up GERD, there's GERD right here. I might want to pull up CAD, coronary artery disease, comes up right here. So very easy to find the right ICD-9 and or ICD-10 code. So the next thing we want to do is go away from the systemic disease. Let's go into the specialties. So I know I have orthopedics and ophthalmology on the phone. So here we could type in, let's say ophthalmology. I mentioned ophthalmology had it relatively easy. Let's type in cataracts. Type in a few letters, and here is cataract, H26.9. Okay? Interestingly, cataract, they don't require laterality. In fact, if I go cataract right side, here's a right side, it's the same H26.9. So you might want to do right cataract and record that in your chart. It's not necessary for ICD-10 right now. The World Health Organization has created more granularity in other sets of codes, but not in this cataract, for example. However, if I do nuclear cataract, this is where laterality becomes a requirement. So I'm going to go nuke cat. And by the way, if I go nuke cat, here it says nuclear cataract, notice I could do it the other way. I could do cat nuke. And it pulls the same thing up. But notice here, there are some items that have a triangle next to it and some that don't. Where there's a triangle, it means that we're not at our highest level of specificity, and there are some attributes that we need to define for this diagnosis to find the right ICD-10 code. So you can see these don't have arrows, right? Because you can see the different ICD-10 codes for laterality, both left and right. So here are the different H25.11, 12, and 13. But just if I go right to nuclear cataract and try to add it, and I click my green plus, SRS is not going to let you add this because there's the triangle there, and it knows that laterality is required. So if I click the plus here, it's going to pull up a screen where it has all the different types of nuclear cataract, H25.10, 11, 12, and 13 for unspecified left, right, and bilateral. And I could just choose it directly right here, or I could narrow down the search. I could click left, and here's the correct ICD-10 for nuclear cataract left eye, H25.12, and I'll just click plus and add that. One more I'll show, open angle glaucoma. So there's also a triangle, and when I click the plus, it's not laterality. What they're asking for is the attribute is what stage it is. So here I'll do mild stage, and it will find H40.11X1 is the correct ICD-10 code. Okay. So moving right along, I just added some ophthalmology codes. Now I'm going to go to musculoskeletal, where there's a lot more permutations. But we'll start easy, just with something like carpal tunnel. Type in carton. Again, you could see obviously carton, there's left, right on both sides. I could either click the plus here, notice the triangle, and it's going to ask me what's the laterality, or I could just go right in and let me do it this way. Click carpal tunnel right wrist. I'll click the plus and just add it right from this screen. I don't need to go to that screen where you have to choose laterality. We want to go into something a little more fancy. Let's say an eponym like Barton's fracture. So here I could do BART-FX. Notice I don't need to go type fracture. FX is that nomenclature that I use to signify fracture, so I could just type BART-FX, and there's Barton's fracture. And this is now where there are a lot more permutations. So this is where our tool really shines. If I click the, you'll see the triangle here, so it's asking for more information, and I click the plus, and it asks 4 questions because there's 4 attributes, and we need to narrow down all these Barton's fracture ICD-10s. And this is where people get a little bit concerned about ICD-10 is how am I going to find the right code? This is the haystack, how am I going to find the needle? So let me show you how we do that. I'm going to put an initial encounter, and notice when I click that, the healing, there's a healing, is it a routine or delayed healing or non-union or malunion? It's grayed out because we don't have to worry about that for our initial encounter. And when I click initial encounter, we've already reduced our choice from several dozen to just 3, 6, to just 9 choices. Here I'll do it's a closed fracture. We narrowed down our list further, and it's on the left side. And here is our initial encounter closed fracture, left side, Barton's fracture. So it's an S52.562A. I'll add that. Let's take a look at hip fracture. I type hip FX. Again, it used to be really easy. This one has even more permutations. If I click the plus here, we could see the list is even longer than the Barton's fracture. And here I'll do subsequent encounter, routine healing, open type 1 or 2 on the right side. And that long list gets narrowed down very quickly to S72.001E, and I'll add that. And when I'm done, I close my app, and here are all the diagnoses listed here. In plain English, by the way. No longer do we have that technical term for the ICD. I hope what you saw today makes you feel good about SRS's approach to ICD-10, and at least from the clinician's standpoint, the ease of transition from ICD-9 to ICD-10. Well, thank you so much for attending. If you have any questions, here's my email, evan@srssoft.com. Just shoot me an email and I'll help you out as best as I can. Have a great day.